Scaphoid fracture. It's very important in AMC exam. The first keyword is any patient came with history of fall on outstretched hand with severe pain at the hand. If the case scenario talking about this only, that's mean scaphoid fracture in AMC exam. So any patient, whatever the age of him, fall on outstretched hand with severe pain at the hand or at the wrist, this means scaphoid fracture. The second keyword is patient fall on outstretched hand and came with tenderness at anatomical snuff books. This means scaphoid fracture. Okay? And the final keyword is the X-ray itself. If you look at this X-ray, this represents scaphoid fracture. And if you find X-ray like this in AMC exam, this means scaphoid fracture. A very important note related to scaphoid fracture is that radiological changes only appear after 2 weeks, so please repeat the X-ray after 2 weeks for any patient suspected to have scaphoid fracture. It's very important and mandatory. A very important and dangerous risk related to scaphoid fracture is avascular necrosis because of unique blood supply to this bone. So scaphoid fracture can cause avascular necrosis to this bone. So keep this in your mind. For treatment, in case of stable, which is a very common in AMC exam, thumb spica cast is the treatment of choice. If you look at this picture, this represents thumb spica cast. And in case of unstable scaphoid fracture, the treatment will be open reduction and internal fixation. Mallet finger. The cause of mallet finger is trauma. Look at this picture. This represents mallet finger. And for treatment, simply by hyperextension of distal interpharyngeal joint for 6 weeks by using non-adhesive tab, like in this picture. This represents non-adhesive tab. That's all. Finally, rupture biceps tendon. It's usually occur in elderly, and the keyword of it will be old age patient did sudden traction force to his biceps muscle and came with picture like this. This picture is very important. This represents rupture biceps tendon. That's all. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.